Right, so now we shall be discussing mainly about the inguinal region. Okay, so the inguinal ligament and all these things. So all of you know that this part whatever I have drawn here, this is your anterior superior iliac spine. Okay, so this one over here is your anterior superior iliac spine. Now after that, this part over here whatever I am drawing right now, right, so these are the structures over here. Here you can see few important structures. Now this one which is in the center here, this is called as pubic symphysis. Okay, and all of you know that here you have got another pubic bone like this. So this is pubic symphysis, and after the pubic symphysis, let me draw it, name those things here. Right, so this part which you can see here, this is called as pubic tubercle. This is called as pubic tubercle. And the part which is more front to it, this is called as pubic crest. Okay, and finally this part is called as pectineal line. This part over here is called as pectineal line. Okay, now I'm drawing a ligament which extends all the way from anterior superior iliac spine to the pubic tubercle here. Okay, so this is called as your inguinal ligament. Okay, so but I want you to remember what is pubic crest, what is pubic tubercle, and what is pectineal line. So now we shall put the same picture and do the same things here, and then add one by one here. What is inguinal ligament actually we shall discuss. Okay, so let me put up the same picture once again. So this is the same picture here. Now here you can actually know a couple of things. Okay, so what are these important things here? So let me put the inguinal thing here. This is a pubic tubercle, pectineal line, pubic crest. Yeah, so let me stretch this out a little bit all the way till here. Right, now if you exactly look here guys, one very important thing is that, see, for example, this one over here is your this page whatever is it, this is your external oblique muscle. Okay, now this external oblique muscle, this is the lower part of the external oblique muscle, or see wherever I'm putting my hand, this part is completely called as the aponeurosis of external oblique, and this is the muscle, this is the aponeurosis of external oblique. So what will happen is that in the inguinal region, this aponeurosis of external oblique will fold inward like this. Okay, so this will fold inside. So what has happened to the lower part? The lower part is folding inside. So as this lower part is folding inside, this forms a ligament, and this is called as inguinal ligament. Okay, so how is inguinal ligament formed? Inguinal ligament formed by the infolding of the aponeurosis of external oblique muscle. Okay, so if you look like this, you can see a narrow tunnel, right? This is called as canal. What canal? Inguinal canal. So inguinal ligament is having inguinal canal. Okay, right. So what I was trying to tell you is that, let us say that, see, this muscle whatever is here, this muscle here is your external oblique muscle. Okay, so external oblique muscle stretches all the way down here till, okay, till here the external oblique muscle stretches all the way down, and this external oblique muscle is in continuation with this aponeurosis. You see, this is the aponeurosis that is in continuation with this external oblique, and this aponeurosis is coming down and it is folding inward. You see, aponeurosis is coming down and it is folding inward like this. Okay, so it comes down and folds inward, and that forms your inguinal ligament. Okay, now another important thing is that all of you know this is the lateral end and this is the medial end. Okay, all of you know that is, one is the lateral, another one is the medial end. Now on the medial side, if you see, this inguinal ligament, some of the fibers of inguinal ligament, right, they are reflecting backwards like this, right? You see, some of the fibers from inguinal ligament, they are reflecting backward, right? So this reflection of inguinal ligament fibers backward laterally है ना, they are going laterally in this way, they are going laterally in this way. So this is called as lacunar ligament. Okay, lacunar ligament. And this lacunar ligament in the lower part it becomes thick क्योंकि ज़्यादा से ज़्यादा fibers आएंगे यहाँ पे and all these ligaments together they form thick, and this thick ligament, this thick group of fibers, they are resting on which line here? This line is called pectineal line. So this ligament here is called as pectineal ligament. Simple thing, right? The medial most part of inguinal ligament gives out some fibers that go backward, that they reflect backward. They are reflecting backward and together they form a ligament that is called as lacunar ligament. Okay, so all these fibers of lacunar ligament they join together and form a cord or a thick ligament down, right? This is called as, by the picture itself it is very clear, this is called as pectineal ligament because it is lying on the pectineal line. Okay, now next important thing is that all of you know that this is the midline of the body, this is the midline of the body, right? And this inguinal ligament whatever is there, it gives some fibers, okay, and these fibers are running towards the midline. You see, these, it is giving out some fibers and these fibers are running towards the midline, it is running medially upwards, right? So these fibers are called as the reflections of inguinal ligament. So that is why this is called as reflected part of inguinal ligament. This is called as reflected part of inguinal ligament. So this one over here is called as the reflected part of inguinal ligament. Okay, reflected part of inguinal ligament. And this one over here is called as lacunar ligament. This one over here is called as lacunar ligament, and lacunar ligament together at the base it forms this ligament over here, and this is called as pectineal ligament. Pectineal ligament. Okay. Next important thing is that here you need to understand two important things. I'll explain you in detail about these two important things later on. For now, what you need to understand is that within the inguinal region we have got two rings. Okay, one is called as superficial inguinal ring, another one is called as deep inguinal ring. Okay, what is one called as superficial inguinal ring or dusra deep inguinal ring? How superficial inguinal ring is formed, how deep inguinal ring is formed, I will discuss. So just I'll discuss it in the form of points, but I'll explain those points later on. Okay, just remember in the form of points only right for now. Okay, so there are two rings, one is called as superficial inguinal ring. Okay, another ring is called as deep inguinal ring. So there are two rings, as I told you, superficial inguinal ring and deep inguinal ring. So how is superficial inguinal ring formed? Superficial inguinal ring is formed How is superficial inguinal ring is formed? Superficial inguinal ring is formed in this way that it is a defect. Superficial inguinal ring is nothing but a defect in the aponeurosis of external oblique muscle antero-inferiorly. Okay. So for example, let us say that this is external oblique, I told you, right? This is the external oblique, I told you, right? Now this external oblique is folding inside, I told you, right? So it is folding inside like this to form inguinal ligament, right? So exactly here you will have a small defect like this. So aponeurosis of external oblique muscle, right? I told you this part is muscle, this part is aponeurosis. Aponeurosis of external oblique muscle antero-inferiorly, it is having a defect. This defect is nothing but called as your superficial inguinal ring. Okay, about the defect I'll explain you in detail, okay, with the pictures and all, but for now just remember it as defect in the aponeurosis of external oblique muscle antero-inferiorly forms the superficial inguinal ring. Now, how deep inguinal ring is formed? Deep inguinal ring is formed when there is a defect in transversalis fascia. transversalis fascia. You know, we have got a muscle called as transversalis abdominis muscle, right? After that, we have got a fascia called as transversalis fascia. So you remember all the layers of the anterior abdominal wall we discussed, right? What are the layers of the anterior abdominal wall? The outermost layer is your skin. After the skin, you have got superficial fascia. After the skin, you have got superficial fascia. After the superficial fascia, we have got external oblique muscle. Then we have got internal oblique muscle. Then we have got transverse abdominis. After transverse abdominis, we have got transversalis fascia. Transversalis fascia. Right? Now here what I am trying to tell you is that this external oblique muscle anterior inferiorly, it is having a defect, right? So that defect is called as superficial inguinal ring. Okay. If transversalis fascia is having a defect, this is called as a deep inguinal ring. Okay. So these are the two important points you need to understand here. These are the important points which you need to understand. Okay. So for example, if I wanted to draw, okay, for example, if I wanted to draw the superficial inguinal ring, where can I draw this superficial inguinal ring? So let me rub this part over here, right? So let me put it in this way. Okay, put it in this way, right? So all of you just look here. Here, exactly here you see a ring I have, right? So this ring, whatever I have drawn, is called a superficial inguinal ring. Actually, this is looking like a triangle, but they named it as a ring. Actually, this is a misnomer. Why it is called as a misnomer? Because it is actually not a circular ring. Okay, it is a triangular ring. So this is superficial inguinal ring. So from here onwards, you see the aponeurosis all the way here. You see now? Aponeurosis attaching to the muscle here in this way. So this is your aponeurosis of external oblique muscle. Okay, now I hope you understood how this entire thing is formed like this. So in this, important thing you need to take it as a note. What is the important thing you need to take it as a note? See, this entire thing is a muscle. This entire thing all the way till here is a muscle. Okay, this muscle is having this green color part called aponeurosis. In this aponeurosis, if you look carefully, the lower part of aponeurosis is taking a turn inward, right? It is taking a turn inward. It is infolding itself inward and forming a ligament called inguinal ligament. Now, what is anterior inferiorly? See, this direction is called anterior inferior direction. In the anterior inferior, you see a defect. A defect matlab there is some opening. There is one underdeveloped region is called as a defect. You see a defect in the aponeurosis. That defect you called it as superficial inguinal ring. Okay. Now, if I ask you, put that ring aside. If I put that ring aside, this is how the ring is looking. See, ये pectineal line है. This is pubic tubercle, right? And this is pubic crest, and this is your pubic bone over here, right? So where is that located? Exactly, it is located like this. The ring is located like this. Now, if I ask you, the base of the ring is formed by your pubic crest, right? And next, it is having two crust like things, right? So one which is towards the midline. Again, I'm drawing with the red. I'm drawing. See here, one which is towards the midline. This is called as medial crust. One which is lateral here. This is called as lateral crust. So there are two crusts over here. One is called as medial crust, and the other one is called as lateral crust. Lateral crust, right? So far what we discussed, guys, you know the topography, you know the place from where the inguinal ligament starts and where it ends, right? You know what is inguinal ligament and how it is formed. Inguinal ligament is formed by the infolding of the aponeurosis of external oblique muscle, and the same aponeurosis anterior inferiorly, it is having a defect, and that you called it as what? Superficial inguinal ring. Okay, now that you called it as superficial inguinal ring. Next important thing is that inguinal ligament, medial most part of the inguinal ligament has got some fibers that reflect downwards and go backwards. They go downward and going back or going laterally, right? These form a triangular shaped ligament over here, and this is called lacunar ligament, right? And the fibers of lacunar ligament, all of them, they join together to form a thick cord like ligament, and that is called as pectineal ligament. Okay, so this superficial inguinal ring is having two crusts, medial crust as well as lateral crust. So this one over here, this yellow shaded part over here is your superficial inguinal ring. Okay, so this one over here is your superficial inguinal ring. Superficial inguinal ring, right? Now, next important thing is that, okay, you told me about superficial inguinal ring, then where is deep inguinal ring? So deep inguinal ring is a defect in the transversalis fascia. Okay, so let us see where this deep inguinal ring is located. So once again, for that I need to draw, this is your anterior superior iliac spine, and this is your pubic tubercle, pubic crest, all the way down like this. Okay, right. Now here, this is your inguinal ligament. Okay, and also let me draw this thing also, that here you have got your superficial inguinal ring. This is your superficial inguinal ring. Second important thing, exactly, first of all, what you need to do to find out a deep inguinal ring is that locate where is anterior superior iliac spine, locate where is pubic tubercle. Okay, draw a line. After drawing a line, this is the line where exactly the inguinal ligament is resting. Exactly place the midpoint of the line. Midpoint of the line matlab, see, exactly this is the midpoint of the line. Just above the midpoint, whatever ring you are having deep is called deep inguinal ring. Okay, so this ring over here, so this ring over here is called as your deep inguinal ring. So this ring over here is called as your deep inguinal ring. Okay, now from the deep inguinal ring, and this is your superficial inguinal ring, right? Superficial inguinal ring, and the other is deep inguinal ring. Now from the deep inguinal ring to superficial inguinal ring, you have got a canal, right? This canal is called as inguinal canal. For example, let us take an example of this one. Okay, when I'm folding this paper like this, so this is how the ring is present. Okay, see, this one towards the pubic bone, this is called as your superficial inguinal ring, and this one is called as deep inguinal ring. So this is superficial inguinal ring and this is deep inguinal ring. Now in connecting both of them, you see a canal here. This is called as inguinal canal. Okay, so this part over here is called as your inguinal canal. This one is your inguinal canal. So what is the importance of inguinal canal? Inguinal canal is around 4 centimeters in length. Okay, and where is this inguinal canal located? It is located above the inguinal ligament. Which part of the inguinal ligament? Medial part of the inguinal ligament. So it is located above the medial part of inguinal ligament. So located above the medial part of the inguinal ligament. Okay, now what is this inguinal canal? In the males, inguinal canal is consisting of spermatic cord. Okay, so if you look at the inguinal canal, so in the males, right, in the males, so in the males, inguinal canal is consisting of what? Inguinal canal is consisting of spermatic cord. But whereas in females, the inguinal canal is consisting what? Round ligament of uterus and ilioinguinal nerve. Okay, so it is having round of uterus, round ligament of uterus and ilioinguinal inguinal nerve. So there are two important structures which you need to remember. One is called as your spermatic cord, okay, and in the females there are two structures you need to remember. One is round ligament of uterus and the other one is ilio-inguinal nerve, okay, right. So we discussed all these things, right? Let us see. First thing, we have already seen that how external oblique muscle, right? What is the role of external oblique muscle in inguinal region regarding the superficial ring or deep ring or whatever it is. So we discussed how external oblique muscle plays a role in the formation of ring, right? So external oblique muscle, aponeurosis, anterior inferiorly, it forms superficial inguinal ring. Now we shall see how internal oblique muscle plays a role in the formation of any ring. Will it form any ring or will it cover the ring which is already present, or what does it do? And we shall also see how the transverse abdominis muscle is in relation with the ring, okay. So now let us draw a picture and see what are the structures here, okay. So one side I will be drawing one muscle, on the other side I will be drawing another muscle over here, okay. So let us say that this is your pubic tubercle, pubic crest, and all the way like this, right. This is the way, right. Now here you have got anterior superior iliac spine. Let us also tell that here also you have got anterior superior iliac spine. Now from anterior superior iliac spine you have got this ligament that is called as your inguinal ligament, right. So the same thing again, inguinal ligament. So here also let me draw this inguinal ligament all over here. This is the inguinal ligament, right. Now what did I tell you? I told you just above the midpoint. Just above the midpoint here you have got a deep inguinal ring. Here also just above the midpoint you have got a deep inguinal ring, okay. Now the first muscle which we shall be discussing, right, the first muscle which we shall be discussing is internal oblique muscle, okay. So external oblique is done. Now we shall discuss about internal oblique muscle. External oblique forms a superficial ring, that is done. Now internal oblique. Now, from where does this internal oblique fiber start? Internal oblique fiber starts from the lateral 2/3 of inguinal ligament. This is inguinal ligament. So, lateral 2/3 in the sense this one, right? So, from the lateral 2/3 of inguinal ligament. From the lateral 2/3 of inguinal ligament, the fibers which are starting are the fibers of internal oblique muscle. First of all, these fibers go up medially like this, right? So they are ascending up medially in this way, yes or no? So these fibers are ascending up medially. And not only that, just look here, these fibers, once they approach the deep inguinal ring, they cover the deep inguinal ring from the anterior end. So they are also covering the deep inguinal ring. And after covering, what will happen is that some of the fibers, right, some of the fibers, they make a curve like this, right, they curve, they reflect in this way, and these reflected fibers, they come all the way and they insert to the pubic crest, okay. So if you can see here very clearly, what I have done is that, so these fibers are originating, this is internal oblique muscle, IOM, internal oblique muscle. So the fibers of internal oblique muscle are originating from the lateral 2/3 of inguinal ligament, and once they originate, they cover the anterior part of the ring. So they are passing anterior to the ring. Not only they are passing anterior to the ring, and they are also making a curve. These fibers are reflecting downwards and attaching to the pubic crest. Now these reflected fibers together, they are forming a tendon like thing here. That is why this is called as conjoint tendon. Conjoint tendon. This is called as conjoint tendon. Okay. Now this is all about your internal oblique muscle. So let me write it clearly. This is all about your internal oblique muscle. Now after internal oblique, the next muscle we have got is transverse abdominis. Now let us look at the transverse abdominis. Now transverse abdominis muscle fibers, right, they are also coming all the way like this. See, these fibers, from where do they start? The internal oblique started from lateral 2/3. Now here these fibers start from lateral 1/3, lateral 1/3 of inguinal ligament. Now from the lateral 1/3 in the sense till here, right? So from here all these fibers are ascending up medially, they are going up medially, and what is happening, look here, these fibers here, they are not crossing this deep inguinal ring, they are not passing anterior to deep inguinal ring. But here internal oblique was passing anterior to deep inguinal ring. Here they are not passing anterior to deep inguinal ring, rather they are reflecting in the same way as internal oblique muscles fibers reflected. They are reflecting downwards like this, and they reflect, and finally they are also attached to your pubic crest. So here also another conjoint tendon is formed. So if I ask you conjoint tendon is formed by, you should tell me part of internal oblique muscle and part of transverse abdominalis. So part of internal oblique and part of transverse abdominalis. So two of these muscles together, they form such tendon, and this tendon over here is also called as conjoint tendon. So part of conjoint tendon is formed by IOM muscle, part of conjoint tendon is formed by transverse abdominis muscle. Not only that, if you look here carefully, some of these fibers, they are even making a shelter head. Not only that, if you look here carefully, some of these fibers, they are reflected down, right? They are even covering the medial surface of the ring, right? So ring has got one lateral surface. Ye dekho, ring has got this surface is called as the lateral surface of the ring, and the blue one is called as the medial surface of the ring. So these fibers are making a arc like this, and they are covering the medial surface of the ring here. Now these fibers are called as interfoveolar fibers, okay? So these fibers over here are called as interfoveolar fibers. These fibers over here are called as interfoveolar fibers. So I hope you understood both of these things, right? Now let us move on to another thing. Let me draw the picture again here. Let us discuss some more important things. So here we have got pubic tubercle. Now by now you might be perfect that this is the pectineal line, pubic crest is this, and all the way pubic symphysis, and it is like this, right? So here this is the thing. Now all of you look here. Here you have got a muscle like this. Now this muscle, which is present all the way here attached to the pubic crest here, this is called as your which muscle? This muscle is called as your rectus abdominalis. Okay, so this muscle over here is called as your rectus abdominalis muscle. This muscle over here is called as rectus abdominalis. And next here you have got your anterior superior iliac spine. So this ligament over here is your inguinal ligament. All of you know this thing, right? Now what I am trying to tell you is that exactly in the midpoint here you have got, what is this? This is your deep inguinal ring. Just beneath the deep inguinal ring, you have got an artery over here. This artery is called as external iliac artery, right? If you remember, the abdominal aorta will divide into two common iliac arteries. So common iliac will again divide it into external iliac and internal iliac artery. This external iliac artery, after the inguinal ligament, it continues as femoral artery. So this is the external iliac artery which is continuing as femoral artery beneath the inguinal ligament. Okay. So this artery which you can see over here, this artery is called as external iliac artery. Just medial to this external iliac artery, you have got a vein here. This vein is called as external iliac vein. So this vein over here is called as external iliac vein. This vein is called external iliac vein. Now from external iliac artery you see a branch that is going up like this all the way. Now this branch is called as inferior epigastric artery. This is called as inferior because it is going from the down, right? So inferior epigastric artery. Now here if you watch carefully, you can actually see a triangle here. You see, there is a triangle, right? This triangle is called as inguinal triangle or Hesselbach triangle. Okay, Let us write what are the borders of this triangle. This triangle over here is called as inguinal triangle or Hesselbach's triangle, inguinal triangle or Hesselbach triangle. So this is a triangle over here. Now in this inguinal triangle or Hesselbach triangle, what are the borders? There is a medial border. Okay. Apart from that, there is also a lateral border, medial border, lateral border, as well as the inferior border. Medial, lateral, as well as inferior border. Right. Now, when it comes to the medial border, what are the structures that are located? See, this one is your medial border, and this is your lateral border, and down here, this is your inferior border. Okay. So, what are the structures that are located medially? Medially, I have got lateral surface or lateral border of rectus abdominis. Right. So, even if this is rectus abdominis, this is a lateral border. Here also on the other side, this is also a lateral border. Right. So, I have got lateral border of rectus abdominis. Next, laterally, what do I have? Inferior epigastric artery. Laterally, I have got inferior epigastric artery. And inferiorly, what do I have? Inguinal ligament. Which inguinal ligament? Medial half of inguinal ligament. Medial half of inguinal ligament I have got. Okay. So, medial half of inguinal ligament. And again, all of you look here that this inguinal ligament has some branches. I told you it reflects downward and backward like this. You see branches that are reflecting downward and backward. So, these fibers are called as lacunar ligament, and the lacunar ligament downwards it will give one more ligament here over the pectineal line called as pectineal ligament. Right. Now, for example, if I am drawing a ring over here, a structure over here. Now, tell me what are the borders of this structure. See, anterior to this, anterior matlab jo upar hai, that is anterior. Anterior to this, you have got inguinal ligament. Anterior to this, you have got inguinal ligament. See, this is the anterior end. Anterior, you have got inguinal ligament. And after this anterior end, look at the medial end. Medially, what do you have? Lacunar. See, medially, I have got what? Lacunar ligament. Lacunar ligament. Right? Next, posteriorly. Posteriorly, what do I have? Posteriorly, what do I have? See, posteriorly, for example, if I am extending the pectineal line, even this pectineal ligament is also extended. So, posteriorly, what do I have? Pectineal ligament. Pectineal ligament I have posteriorly. And finally, laterally. So, medial is lateral. So, here laterally, what do I have? External iliac vein. External iliac vein, right? So, all these structures are the borders of this ring called as femoral ring. This is a femoral ring. So, all of these structures are called as a femoral ring. Now, if there is any organ that is protruding into the femoral ring, the bowel loops, this is called as femoral hernia, right? Now, here the most important reason why I am discussing all this is you have to know what is a direct inguinal hernia, what is a indirect inguinal hernia. This is very, very important. Now, in this picture, I cannot show you what is a direct and indirect inguinal hernia. From the lateral side, this is the anterior view. From the lateral view, I can very clearly show you what is a direct and indirect inguinal hernia. Okay. For example, let us say this is a scrotal sac, this is a testis all over here, right? And let us also tell that this is your abdominal wall. Okay. Now, here you will find two rings. See, one ring which you can see exactly here, right? One ring which you can see here. A simple way to tell is that, see, this one is called as your deep inguinal ring. Okay, so this one is called as your deep inguinal ring. Okay, after that The inguinal ring which you are having here, this is called as superficial inguinal ring. One is called deep and this one is called as superficial inguinal ring. Okay, so this is called as superficial inguinal ring. Okay, for example, this, let me put up the same picture and explain you what is the hernia over here. For example, just look at this. Right. So let me put up the picture over here. Yeah. See, if the abdominal wall contents, right? If the abdominal wall contents are protruding like this, see, the abdominal wall contents are not entering into deep inguinal ring, rather they are coming aside of deep inguinal ring and they are entering through the superficial inguinal ring in this way, right? So if these contents are entering through the superficial inguinal ring and they are protruding out, this kind of hernia you call it as direct hernia. So what is direct hernia? Direct hernia is directly the contents are entering into the superficial inguinal ring. Okay. For example, what is indirect hernia? Indirect hernia in the sense, for example, let us say this is your peritoneal layer, right? And this is the testis over here, right? So let me put up the same picture over here also. Yeah. Now, where are the rings? So this one over here is called as our deep inguinal ring, and here we have got this ring. This is called as a superficial inguinal ring. For example, if the structures are going in this way, see, this is deep inguinal ring and this is superficial inguinal ring. For example, if the structures are going in this way, first they enter into the deep inguinal ring, right? First the bowel loops are entering into deep inguinal ring and then the bowel loops are entering into the superficial inguinal ring in this way, right? So first they have crossed the deep inguinal part and then they have entered into the superficial. So this is called as indirect hernia. Indirect inguinal hernia. Indirect inguinal hernia. So direct inguinal hernia, it doesn't come in contact with the deep inguinal ring, but in indirect inguinal hernia, first it crosses the deep inguinal ring and then enters into the superficial inguinal ring. Okay, right. Now within, and by the way, what is this? These are bowel loops, guys. Okay, these are bowel loops. So these are the intestine, parts of your intestine. These are the bowel loops that are herniating inside like this. Okay, right. Whatever it is, now you know that inguinal canal, is consisting, in the males, inguinal canal is consisting of spermatic cord. Spermatic cord. Now let us see what are the structures that are located in the spermatic cord. Just remember the mnemonic FANO into 3. What does FANO into 3? You will understand now. So spermatic cord is consisting of F. F stands for fascia. So what are the types of fascia that the spermatic cord is consisting of? One is internal spermatic fascia. Internal spermatic fascia. When I tell internal spermatic fascia, opposite of internal is external. So external spermatic fascia. External spermatic fascia. And finally you have got the cremasteric fascia. Cremasteric fascia. So F is having how many components here? 3 into 3. Next A. What does A stands for? Arteries. So what are the arteries that are located in the spermatic cord? We shall see now. So what are the arteries, guys? The one artery is testicular artery. Testicular artery is one artery. Okay. After the testicular artery, next you have got artery to vas deferens. Artery to vas deferens. Third important thing is artery to cremaster. Artery to the cremasteric muscle. Okay. So these are also 3. And next, after the arteries, next we have got nerves. We have got the nerves. What are the nerves we have got? The first important nerve is ilio-inguinal nerve. The first important nerve is ilio-inguinal inguinal nerve. Okay, and the second important nerve is genital branch of genitofemoral nerve. Genital branch of genitofemoral nerve. Okay, next, what are the other structures that are located other than this? FANO, O stands for the other structures. The first important structure is vas deferens. So these are the things which you just have to remember, guys. Vas deferens, and next one you have got is pampiniform plexus. Pampiniform plexus, and third one you have got is testicular lymphatics. Testicular lymphatics. So guys, we shall, as I already told you, that now we shall look at each and every layer one by one, how they are related with the rings. Okay, so here in this picture, if you can see here, right, so all of you know that this center one is called as your rectus abdominis. This center one is called as your rectus abdominis, and this muscle which you can see here, this is called as external oblique muscle. Okay, so this muscle over here is your external oblique muscle. Okay, if you look at the inferior part of the external oblique muscle, it is folded inside, right? So the aponeurosis of external oblique muscle, the inferior part of the aponeurosis of external oblique muscle will fold inward and form inguinal ligament. This is your inguinal ligament. Okay, and all of you can see anteroinferiorly here, anteroinferiorly you see a defect here, right? This defect is called as your superficial inguinal ring. Superficial inguinal ring. And just guess, where is this deep inguinal ring? Exactly in the midpoint, right? Just above the midpoint, here you have got midpoint of the inguinal ligament, here you have got deep inguinal ring, right? So I'll show you later on what will happen, I mean how this deep inguinal ring is formed, right? But by the way, if you see here, this is external oblique muscle. After external oblique, if I remove this layer, the next layer will be internal oblique. So just look at the next layer here. See, this layer is called as internal oblique muscle. So here we have got internal oblique muscle, right? If you look at internal oblique muscle, you can see the inguinal canal here, right? See, this one is the inguinal canal. Now internal oblique muscle forms what borders of inguinal canal? If you can very clearly look, see, this is the anterior border of the inguinal canal, and after that this is the posterior border of inguinal canal, and after that here you have got the superior border of inguinal canal. So internal oblique muscle forms the anterior border, posterior border, as well as superior border of inguinal canal. Superior border of inguinal canal, right? And through that inguinal canal, what is this coming out? This is your spermatic cord. I told you, inguinal canal in males, within the inguinal canal in the males there is spermatic cord, and in the females it is ilioinguinal nerve and the round ligament of the uterus, right? So after internal oblique muscle, the next, if I remove this layer, the next layer I will get is transverse abdominis. So this is your transverse abdominis muscle. Transverse abdominis muscle. If you look at transverse abdominis muscle, it mainly forms two layers. See, this layer is called as the posterior layer, and which is on the top, this is called as a superior layer, right? So it forms a posterior border and superior border of the inguinal canal, right? So it forms the posterior border as well as the superior border of inguinal canal. Okay, after transverse abdominalis, next we have got is a fascia. That is why there is no redness here, right? No muscle, only the fascia. You see, fascia is also having a defect here, right? This defect is nothing but called as deep inguinal ring. So what fascia would be this? This is a transversalis fascia. This is a transversalis fascia. Transversalis fascia containing a deep inguinal ring. So it is having a defect, right? It is having a defect, and that defect is called as deep inguinal ring. So that is called as a defect, and that is called as a deep inguinal. Okay, right. So if you are looking from the lateral side, let us see what are the structures that are located on the roof, floor, anterior as well as the posterior wall. Okay, so just imagine here, guys. Anteriorly, what is the muscle you have? Anterior most you have got what? External oblique muscle. Behind the external oblique you have got internal oblique. Behind the internal oblique you have got transverse abdominis muscle. After the transverse abdominis muscle you have got transversalis fascia. Okay, so anterior most here, the muscle which you have anterior most over here, what is this muscle? Let us say this muscle over here is your external oblique muscle. Okay, just behind that, the next muscle whatever you have is your internal oblique muscle. This is your internal oblique muscle. And just behind the internal oblique muscle, this muscle whatever you are having, this is called as a transverse abdominalis muscle. Now, in this external oblique muscle, let me write these names here. So, this is called as external oblique, and this is called as internal oblique, and this is called as transverse abdominalis. Right? Now, if you look here, guys, I told you external oblique muscle, aponeurosis in the lower part will turn inside and form what? Inguinal ligament. See, this is the aponeurosis. This aponeurosis is coming down, and it is turning like this and forming what? This is called as inguinal ligament. Okay, and finally, here we have got a fascia that is continuing with this inguinal ligament over here. This is called as transversalis fascia. Transversalis fascia is the place where you have got deep inguinal ring, right? Now, within this inguinal ligament, see, this one is your inguinal ligament. This one is your inguinal ligament. Within the inguinal ligament, in case of males, right, inguinal ligament is having inguinal canal. Within this inguinal canal, what do you have in the males? You have got spermatic cord. So, this is your spermatic cord. This is your spermatic cord, and this is your inguinal ligament, right? So, which is an anterior end? This is your anterior end, and this one is your posterior end. And what is this fascia? Transversalis fascia. Transversalis fascia. Now, let us look what are the structures that are forming the roof of the spermatic cord, the floor, anterior as well as the posterior. If you look at the roof is having, let me use another color, the roof is having two muscles, right? So, exactly directly above this, what are the structures that are located here are the roof. One is your internal oblique muscle, another one is your transverse abdominalis muscle. Next important thing is that anteriorly what muscle do you have? Here, anteriorly what is the muscle do you have? You have got a muscle called as external oblique muscle, right? And after that, the floor here is consisting of what? Inguinal ligament. And the posterior end on the back, it is consisting what? Transversalis fascia, right? So, spermatic cord on the top, two muscles. Anteriorly, there is one muscle here, right? So, let me stretch it out a little bit so that it will be easy for you to understand here. So, anteriorly, you have got this muscle all the way, and this is called as external oblique muscle, right? So, all of you look here. Anteriorly, external oblique. On the roof, you have got two muscles. One is called internal oblique and transverse abdominalis. And posteriorly on the back, you have got this fascia called as transversalis fascia. And on the floor down, you have got inguinal ligament. Okay. So, these are the structures that are surrounding the spermatic cord. So, let us write it down now. So, the roof is consisting of internal oblique muscle, and transverse abdominalis, two muscles, right? And after that, the anterior side is consisting of external oblique muscle, right? And next you have got the posterior side. The posterior side is consisting of transverse fascia, and the floor is consisting of inguinal ligament. Now we shall see at what month, repeat. Now we shall see at which month the testis from the abdominal wall descends down into the scrotal sac. Okay. So the dates, the timings, repeat. The months, right, are very important. The months and weeks are very important here. So, right. So here all of you know that here we have got our inguinal ligament, right? So this is the inguinal ligament over here. And you know we have got the pubic symphysis over here, and hanging down from that you have got your testis. This is your scrotal sac. All of you have to remember that first the testis lies in the abdominal cavity. So in the upper abdominal cavity here, this is the place where the testis lies. Now at which month will you see the testis there? You will see the testis there during the 2nd month or 7th week. 2nd month or 7th week. Next important thing is that just above this, above the mid inguinal region, you have got a deep inguinal ring. Okay, and this is called as a canal. All of you know what is this canal? Inguinal canal. And here you have got a superficial inguinal ring, right? The medial most is the superficial, the lateral most is the deep inguinal ring, right? So now at which month will the testis descend down to the inguinal region? Which month will the testis descend down to the inguinal region? So it descends down to the inguinal region during 3rd month. Now 2nd month it is in the abdominal cavity. Now during the 3rd month it descends down in the inguinal region. 3rd month, right? And when will this testis enter into the canal here, inguinal canal? See, from 3rd month it is near the inguinal ligament, right? Near the deep ring actually. Now from the 3rd month it would take a time of around 3 to 4 months, right? And exactly at the 7th month it will enter into your inguinal canal. And from the inguinal canal to pass through the inguinal canal, it will take around 3 to 4 days of time. So it will take around 3 to 4 days of time to pass through the inguinal canal. Finally it passed, and after passing, finally you will see the testis down in the scrotal sac at 9th month of age, right? Finally at 9 months you will see the testis in the scrotal sac. So, and you know the testis down to the scrotal sac is held by a fibrous tissue. This is called as gubernaculum. It is called as gubernaculum.